This program is a paid presentation for Dr. Patnesia and is brought to you by Dr. Patnesia. The opinions expressed are those of Dr. Patnesia. Check with your primary care physician before visiting any doctor.
The views expressed on this program are not necessarily the views and opinions of Randy Alvarez. This interview is not an endorsement in any way by the host or the Wellness Hour. Guests are not reading teleprompters or cue cards. The interview was real and expresses the philosophy and approach of the health professional. Check with your primary care physician before visiting any doctor featured on the Wellness Hour. This was a paid program.
The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. We've invited a dentist that is very familiar with this procedure, Dr. Patnesia. Dr. Patnesia, welcome to the program.
Nice to meet you,
Do I
Randy.
have your name right?
Yeah.
Pronounce it right. Okay, good. Now, before we get into today's topic, tell us a little bit about your practice. I guess you have a bunch of dentists you work with, and you do all types of procedures. Tell me about that.
Yes, we have a one-stop shop. All dental procedures we do under one roof.
Okay.
We have different specialists and general dentists in the office.
What type of specialists do you have?
We have a periodontist, orthodontist, general anesthesia,
Okay.
full mouth reconstruction. We do children dentistry. We have, something called CEREC machine where
CEREC, is that right? Okay.
Yeah, where we can make a crown, post-CEREC crown, in 90-minute time, right in the chair, in one stop.
Is that the
permanent crown?
The tooth in a day concept?
Yeah, yeah.
Making a dental crown.
Right, in 90 minutes.
Is that an exaggeration a little bit?
No, that's what it is.
90 minutes.
Yeah.
Can the patients watch?
Yes, patient can
Really?
watch.
Do they watch?
Yeah, we take computer images of the crown prep, and they can watch how we design, and the milling is done in about 12 minutes. We do IV sedation, general anesthesia, all the children who need extensive work, people who have fear of dentistry, we can put them to sleep.
So IV sedation.
IV sedation.
Is that popular?
Yes, it's very popular. Patient comes and they don't know, even if they were on the chair for 6-7 hours, what was done.
They don't know what was done.
But no, what was
They
done.
look at themselves in the mirror and say, boy, my teeth look great.
Yes.
Why is it?
Could
they almost forget that it happened?
Plus,
the whole procedure?
They almost forget, and plus they are not aware of it, where they are.
For dental implants, what are the age ranges?
For the dental implant, we have done as early as 15 years old to 84 years old patient.
84 years old.
Yes.
So at 84, they're not too old
They're
to get a dental implant?
Never too old, because it's a quality of life which you are enhancing. Even if you live 3 years, 4 years, 5, 10, you don't know. But each day of the quality of life is enhanced, tremendously enhanced.
How so?
You're able to smile, you're able to eat the food what you like, and you can go out.
But 84, do they have strong enough bone?
Yes.
And they won't fall out?
They won't fall out.
Really?
Yes.
Okay.
Because the denture, imagine, Randy, the denture gives you only 20% chewing efficiency.
Is that what it is?
Compared to normal teeth.
Okay.
But if you have a dental implant, you're back to 90%. That's huge improvement. And it takes out of them from the psychological pain. Plus they can eat fruits, vegetables, they look younger.
Really?
Yes.
Is this of all areas of dentistry,
Yeah.
the people that you take out of dentures,
Right.
put into dental implants, something fixed in their mouth,
Right.
is this the happiest group?
This is the happiest group.
Is it really?
This is the most rewarding experience for us, for the clinician, as well as for the patient. They love it.
They do?
They love it. They simply love it, because we are taking them out of psychological pain of not being able to smile, feeling ashamed, not being able to eat in restaurant the food of their choice.
Interesting. So you see a lot of changes.
Absolutely.
You're a dentist. Of course you think
Right.
the smile is important and the teeth are important.
Yeah.
Elaborate on that. But you say you see people's lives change.
People basically explain how they were not able to smile prior to the treatment, but now they're able to smile. They can go out, they can move around, and they don't feel ashamed about their smile. That's a huge change.
Okay, so on today's topic, dental implants, what you need to know. What are the different types or categories of patients that you see?
Dental implant, basically you can replace one missing tooth, or you can replace 3 or 4 missing teeth, Our other categories, people have a upper or lower dentures, where you can put 4 implants and it becomes a fixed set of teeth for them.
So a denture wear, this all on 4.
Right.
You refer to 4 implants gives them something like a whole set of teeth in their mouth?
Yes.
Is that right?
Yes, yes.
Okay.
Basically, you put 4 implants. On that, you can put a fixed set of teeth for them. And they got 90% chewing ability right away from day 1. Right. They can go out, they can smile, they can, enjoy the life. Even, people, at the age 60, 70, they want to kiss their partner, they want to go out for date. So they're not ashamed about themselves.
Now, in, anticipating this interview, right, knowing you were going to be on the show, in the U.S., they estimate 18 million Americans are wearing an upper or lower denture. Let's say, I didn't do the research on Canada, but let's say over 1 million people.
Absolutely, yeah.
Thousands in your city?
Absolutely.
Have dentures?
Thousands and thousands of people, yeah.
And so with these denture wears, you're saying with 4 dental implants, for the most part, they can get their teeth back.
Yes.
So why aren't they all doing it then?
I guess maybe they're not aware of it, that this treatment is available, and sometimes there's a fear of pain, sometimes fear of the cost. They don't know what is the outcome it is. But that's why we are on the show, so we want to educate people. Yeah. We want to inform, let them know that this is available.
Denture wearers don't go to the dentist for the most part, is that right?
Absolutely. They don't need to go it because the denture is there and they are basically used to of getting by with it. It's like a crutches, once you lose your limbs, you just carry on with it, holding on to crutches. But this implant, it gives you such a beautiful option. You go back to how you had the ability to chew your food, smile, and...
Do you think that there is a happy denture wear out there?
I guess people have forgotten that how they had their own teeth, how the life was with their own teeth. So they've just gotten used to the denture. But if you're given a choice, if you give them 4 dental implants and the fixed teeth, they will never go back with the dentures.
So if there was a try-in, they couldn't go back?
They couldn't go back.
Is this one of those things where they say, Dr. Pamnesia, do they say, I should have done this years ago?
Absolutely.
Do you ever hear that?
Absolutely. Even I had one 80-year-old patient who himself was saying that I wish I had done long time ago it. Why did I suffer through it? Why did I wait for it?
But it seems very painful, by the way. I mean, dental implants into the bone. You smile. Is that not something they complain about?
Not at all. Actually, I've seen patients, even I put 8 implants, they go back to work next day.
Really?
Yeah. There's a very little pain because the bone is the only part of the body where there's no nerve.
Okay.
So all it is,
So there's okay, good point.
So because there's no nerve, so there's no pain. All it is, you cut a little bit opening in the gum area. And if it is a clean cut, there's no pain in the gum area as well. And that's why people take just a simple Motrin, regular Tylenol.
After the procedure?
After the procedure. And they are back to work next day.
So you think that the denture wearers are afraid of the pain? That's what keeps them from doing it as well?
Absolutely.
Does that come up on the consult? Are they really worried about pain?
That's the most common reason, that they worry about pain. And secondly, they don't know about the procedure. It's a lot of anxiety of unknown. But once they know about it, how easy it is, you can go back to work next day.
They don't like the dentist still? Is that right? Do you ever hear that? I don't like the dentist?
Yes, that's the most common phrase.
They say it every day?
Absolutely.
They really say that?
You ask any dentist. In a typical day, you will hear 2-3 times from the patient that don't mind my saying, I love you, but I hate dentists. That's how it is.
Does it bother you after a while or no?
Not at all.
You get a smile on your face when you hear it?
We just smile because we
know.
What
do you say to that, by the way, when they say nothing, like, no offense, but I hate dentists? What do you say?
I tell them I understand, you must have had some bad experience while growing up, going to the dentist. So those memories stay. But
do they ever end up telling you, I love going here? This is a great place.
Absolutely. All day we hear that. When we go to the hygiene check, meet patients who have come for regular recare appointments, they all say that we love coming here. Staff is so knowledgeable, nice, well-informed.
Interesting about the pain, by the way, that you say that the patients don't complain about pain because I guess it's the bone. But an 80-year-old, okay?
Right.
I spoke to some people, spoke to a medical doctor. In fact, my mother,
right,
73 years old. she says her doctor said she's too old for dental implants, they'll fall out. What's your response to that?
There is no such thing that somebody is too old for denture implant. It's all is, basically it works in all the cases. So it all is about getting the quality of life back.
Quality of life, eating,
chewing, no pain, not feeling ashamed, and giving a full smile at the public place rather than hiding your smile. Those are the things you're looking for.
Okay, backing up. Why would somebody, okay, so they're missing one tooth.
Right.
What's the advantage of a dental implant over whatever traditional dentistry does?
One tooth implant, basically when there's one tooth is missing, you have, old dentistry did offer that you can shave down other teeth right beside it.
So they're missing one tooth.
Yeah.
They shave down two teeth. The side teeth. Okay.
Side teeth. And then you can put a bridge there.
All right.
But what it does, that every 10 years or so, you have to replace the bridge. You have to go back, you have to cut it again and redo the bridge. Whereas the dental implant is almost for a lifetime.
Okay. I mean, it could last as long as...
As long as you live. That's how...
So the bone just grabs onto the...
Right.
The titanium post?
Yeah.
Is that right?
Yeah. It grabs onto, it doesn't get cavity, it will never require root canal, and it's perfect.
Now, why is it though? Because you say that it can be done in one day.
Right.
They have the tooth on and they go home and they can even eat.
Yeah.
Why is it, I'll talk to some people and they say the problem with dental implants is it takes about 9 months to heal before you get the tooth. Is that the way it used to be? Is that old technology? What's changed? I guess my real question is what's changed over the last 15 years to make it better?
Now actually there's a more understanding about it. That before we always thought that the implant is placed and then you have to wait 6 to 9 months before we can attach the tooth. Now we can do the immediate implant.
Immediate implant?
Immediate implant and put a tooth right away on top of it. Many times patient walks in, broken front tooth, and we do want to put an immediate implant and temporary crown so that way we don't lose the gums profile, the aesthetics. Because once the soft tissue is shrunk, we cannot grow it back. So now we have a better understanding and it works very successfully.
So they meet with you on the initial consultation, they could actually come back at a later appointment and then immediately place the dental implants.
Patient walks in, within an hour or hour and a half, you take the tooth out, put an implant, put a temporary crown, they have a smile back, they go back to work.
They can eat?
They can eat.
How soon can they eat though?
On that tooth for a couple of weeks you have to be gentle, but
I see a video, which was hard for me to believe. They get dental implants.
Right.
It's on the internet.
Right.
They bite into an apple right after the procedure.
You can do it.
Can that happen?
Absolutely, it can happen because those dentures are fixed, those implants are fixed. Basically, that is all showing biting the apple is communicating to you that the dentures, the teeth are solid. That's all it is communicating.
Okay.
And
so
that's
imaging,
what it is.
how is imaging? We talked on the telephone.
Right.
How has imaging changed things?
Imaging allows, before, whenever we want to do dental implant, we will cut the, we'll open the tissue. But then we will find out whether there's a bone is there, soft, less bone, more bone. So we are always sort of wasting time here and there. Sometimes we have to do bone graft and close it only without doing dental implant.
This is the old days.
It's the old days.
Okay.
Now tomography allows you, CT scan, you can do that area, you can see what it is, where the more bone is available, what is the length of the implant. So the procedure becomes faster, more your pre-planning can be done and
so
done
is it
faster.
less downtime? Quite a bit less downtime?
Quite a bit, a lot less.
Okay, so even though you don't actually have a CT scanner in the office, you could, I guess, take advantage of this technology. Now, what about bone grafts from the hip and things like that? Is that a thing of the past almost?
Before it was very commonly done procedure but now it's very rarely done because many times, there are other areas you can use it. And the dental implant, the shapes and their threading and all those have changed with the latest technology. There's a better understanding about the whole concept also.
But back to the person missing one tooth. Do you think a dental implant, because you say it could prevent future tooth loss? Because there's a lot of people missing 3 and 4 teeth. I guess they have bridges or partials in their mouth. You say that those are the people that need implants as well.
Right.
How could that prevent future tooth loss? And maybe somebody watching this is missing 3 or 4 teeth, has a bridge or partial. What's going on in their mouth? What do they need to know?
Basically what happens once you have 1 or 2 teeth missing, other teeth tend to collapse. So gradually you will end up losing more teeth about it. That's why replacement is essential. Plus the top, suppose bottom teeth are missing, top teeth will overgrow. And then they will be lost. That's what
so
is
like a snowball?
It's a snowball effect.
Really?
One tooth is lost. If you don't replace it, other teeth shift, then you lose them also. And that's how most of the people end up wearing dentures over the years.
So people, because there are people, I guess, that go to dentist and they've been told your teeth have to go. You said on our pre-production meeting that a lot of them do nothing. That means they go around and they just don't smile. They hide their teeth.
They
Is that right?
They hide their teeth, and their partner is always complaining that they have a bad breath in the mouth, and they're ashamed of their teeth. Whereas we remove those teeth, put the implant, and they give them fixed teeth. They're as good as new one. It's clean.
So periodontal disease is like an infection.
Yes.
Okay. So this infection causes the bad breath. I guess there's some immune problems associated with that. I did some reading on this, by the way.
That is true. That's what the latest research says, that people who have advanced gum disease, periodontal disease, they have more tendency to get, heart disease, stroke, and other kind of infection.
So you remove the teeth if they have to go.
Yeah.
Put in dental implants, and that cleans up or clears up?
Absolutely. It clears up. Right? There's no more gum infection, no more gum disease, no more bleeding gum, no more pain, and you smile, no more bad breath.
Now, I know you have a photo. Yep. And you say husbands and wives or partners, they come in together sometimes.
Right. Sometimes they come together, get the, like this.
What's going on there?
This gentleman walked in, barely smiling, because he's so ashamed of the teeth, the way they look. And
so when they're on the consult, you give them options. He knows his teeth has to go. What is it, dentures or dental implants? I mean, how is it presented?
Basically, we give them both the choices. They can have a dentures or they can have a dental implant and the fixed teeth.
Okay.
And he chose to go with the dental implant with the fixed teeth because he wanted to have his smile back. He wanted to have the confidence to smile and chew anything he wants.
All right.
And you can see it even in this after photo. He's a little hesitant to smile.
He looks like he's in pain also.
Yeah, he's in pain also because he's not used to smiling. He was always shy.
Interesting.
Yeah.
They have to learn how to smile again.
Absolutely. It takes a few months and then you're back to smiling mode because you're confident about a smile. This is an interesting case. In his case, his wife also presented the similar problem, broken down, decayed teeth, and wanted to have fixed teeth and to be done on the same day. So we had general anesthetist gave IV sedation, and we did the whole procedure, and she walked out with a beautiful set of a smile, and she just loves it.
Is that right?
Yeah.
So now they're happy?
Extremely happy.
Okay.
It's a whole life, imagine, Randy, somebody who is not able to smile, who is ashamed of their smile, not able to chew, always in pain, hurting here, hurting there. Now there's no pain, no bleeding gums. They're able to chew anything. They're enjoying the quality of life.
Can they eat meat? I mean, they could eat steak?
Absolutely. That's the key difference in the denture versus implant supported teeth. With a denture, you pretend chewing meat because you can't chew anything.
Tell me about that. What do you mean by that? You pretend?
You think you're chewing, but you're not. You're just moving around the food right, left, and you just swallow it. And that's the people. That's the reason people who have dentures, they have other health problems. Generally, they have a constipation and other health diseases.
Gastrointestinal problems.
GIT problems.
That's a good point. So they're just kind of pushing it.
They're pushing, moving around,
not tearing
and pretending they're chewing. Because denture gives you only 20% efficiency to chew. Whereas the implant, fixed teeth, gives you 90% efficiency to chew.
Is that right? So there's science behind what you're saying?
Yeah.
Okay.
Yeah.
So they get the dental implants, now they could tear their food, chew it.
Chew it. And 90% chewing capacity. It's almost as good as your natural teeth.
Okay.
That quality of life is enhanced. You can chew, plus people with the denture, they don't eat fruits and vegetables because they can't bite anything. But with the fixed teeth, implant-supported teeth, they can bite apple or do anything they want.
Is that right?
Yes.
Are they afraid at first? I mean, do they tell you? I mean, how soon can they really comfortably? Do you recommend they do it? And I should mention, you say his wife comes in, dentures.
Right.
The same day she leaves, and she has a fixed set of teeth in upper and lower.
Comes in.
Is that right?
It comes in with her own teeth, broken down teeth.
Oh, I see.
We removed all the teeth, we put implant, we put the denture, fixed dentures, and she walks out with a beautiful smile. same day.
What are her friends? I mean, now, how authentic or how cosmetic could you make it look?
Beautiful, as good as a natural teeth. You know, these are the porcelain teeth. They look very natural.
Porcelain?
Yeah.
Okay, so you had to extract her teeth. But for the denture wear, typically, in an ideal situation, a 60-year-old, 70-year-old, which is very young today,
Right.
After you have the imaging, in one day,
Right.
they could walk out with a fixed set of teeth.
Absolutely.
Is that right?
Same day, in few hours' time, they have fixed set of teeth, and they can chew whatever they like.
Now, I've had a dentist here
Yeah.
in the United States on the show,
Right.
and she said that, Randy, you can't do 4 on the upper. It's got to be 8 dental implants. You say you could do it with 4. Tell me about that. Elaborate.
These days, you know, like you can put angled implant. Before, we always thought the implant has to be straight only, but the Noble Biocare has done the more research, developed it. Those are longer and angle implant, and you can do with the 4.
Okay, so it's less expensive.
Less expensive, less time consuming, less work for the lab, and less maintenance.
Do you think people count their teeth and say, oh boy, I can't afford dental implants?
That's what actually the old system was. The old understanding was that for every tooth, you need 1 implant.
Really? So when you first started doing this?
Yeah, that's what it was. We always counted you have 10 teeth missing, you put 10 implant. But these days, the understanding is better, implants are better, there's more research is done. You can put almost half the number of the implants. Minimum, you can go with that.
And we're just about out of time, and I really want you to take me through the process of what someone can expect on day 1. But what are other advantages? Things that denture wearers need to know?
Other advantage could be that you can taste the food better because upper denture is covered with the plastic. Whole palate is covered.
Okay, good point.
But once you put the fixed denture on the implants, palate is not covered. So you're less bulky in the mouth, and you can taste the
foods
food
better. Do they tell you that?
Absolutely.
I mean, okay, so people, I mean, do they ever tell you their stories? You know, doctor, I'm eating, chicken. I'm eating vegetables. Do they lose weight? Do they gain weight? What do you hear?
I hear that they enjoy more variety of food eating.
Okay.
They go out more in the restaurant. Prior to that, because of the denture, they were always scared they'll lose, they will fall off. They will eat limited variety of food in the restaurant. Now initially when they get implant supported fixed dentures, most of the time they're eating steaks, which they avoided most of the time eating.
Okay.
And all variety of fruits and vegetable going out, and every day they are thanking us for giving us quality of life back.
Okay, and we really are just about out of time, but patient watching this, they're a denture wearer. What happens on day 1? What are the frequently asked questions? What do they ask every time?
Most of the time they're concerned about is there going to be a lot of pain. That's the and the other question comes
It seems painful.
It seems painful, but we explain them it's minimal amount of pain.
They don't complain about it for the most part?
Most of the part they don't complain it. Most of the time the pain is less than extraction of a tooth.
All right.
Other people concerned about the cost factor. Even suppose somebody cannot afford 4 implant, we can put 2 implant. It still is better
2 dental
than
implants. Tell
2
me about
dental
that.
implant. You can snap
So
on
missing
the
all of your teeth.
Right. You can put 2 implants, the denture snaps on it, although it's not as good as compared to the 4 implant, but at least it's a 50% improvement where they are.
Much better.
Much better.
So 2 dental implants, snap in, snap out.
Yeah.
Interesting. How come you didn't tell me about that earlier in the show?
I guess
you were saving that for last.
No, that's not the case. It's just that
kidding.
people are always looking the best results, and so we don't want to mislead them. Best result are coming by putting 4 implants. Fixed implant.
Well, good for you. Good.
But 2 basically is a compromise. They're sort of, they're thinking.
You don't like it.
We don't like it. Patient also think they wish they get it, because in the past, we used to do more of those. But people used to say, later on they would convert, they will put 4, and it's a gradual process. It's a more work. That's what it is.
So they want 4. Okay.
They want 4.
So they're worried about cost, you say.
Right.
Because they count all their teeth. They're worried about pain, but pain isn't something that should hold them back.
Right.
What else? What else are they afraid of? Oh, they're going to fall out, I guess.
Right.
Or they're too old.
Are they too old? So basically, that's what it is: the pain, the cost. Are they too old for it? Are their dentures going to be stable? We give them the model to try and pull out, the the implants of our denture, just to have a feel of it.
What about in a slower economy? What do you say to people that are holding off for dental implants?
I guess in slower economy, it's better to do investment in yourself. So you can market yourself well. Look at it, Randy. Now, people at 60 is considered what used to be. It is young. What we used to consider in 40s, because the life expectancy is
they're dating
very long.
60, 70, 75
Absolutely.
years old. They're still dating.
Absolutely, and that's what. If you invest in yourself, you have a more opportunity coming up which you can utilize.
Okay, so somebody goes in, and you were saying that some people want it done very quickly, and you could do it in a day. Somebody watching this, they're wearing dentures, they're dating or whatever, and they want it done fast. What's the fastest turnaround?
Fastest
Possible. Great situation.
Maybe 8 to 10 days. We can.
Really?
Yeah. We can, from start to finish, we can give them the fixed teeth.
Okay. Now your final message, and we're out of time. Somebody watching this, they just don't like their smile, or they're wearing a loose-fitting denture. Where does it begin? What's their first move?
They should, they can go to their own dentist, talk about if they want to have an implant, supported fixed teeth, or they can come to visit us. We will be happy to.
Your website has all this information on there?
Our website has all the information on it.
All right. You love what you do, seems like.
Absolutely love that.
All right. I want to thank you for coming to the show. Very interesting.
Thank you,
Good
Randy.
stuff. Good stuff. And thank you so much for the information. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or direct a friend to it that may have a loose-fitting denture, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
The views expressed on this program are not necessarily the views and opinions of Randy Alvarez. This interview is not an endorsement in any way by the host or The Wellness Hour. Guests are not reading teleprompters or cue cards. The interview was real and expresses the philosophy and approach of the health professional. Check with your primary care physician before visiting any doctor featured on The Wellness Hour. This was a paid program. Hi, I'm Randy Alvarez. We are looking for guests that are licensed healthcare practitioners to discuss interesting topics. To become a guest, contact us online at wellnesshour.com or email show host Randy Alvarez at randy@wellnesshour.com or call our offices at 760-434-5559. The views expressed on this program are not necessarily the views and opinions of Randy Alvarez. This interview is not an endorsement in any way by the host or The Wellness Hour. Guests are not reading teleprompters or cue cards. The interview was real and expresses the philosophy and approach of the health professional. Check with your primary care physician before visiting any doctor featured on The Wellness Hour. This was a paid program.
This program was a paid presentation for Dr. Patnesia and was brought to you by Dr. Patnesia. The opinions expressed are those of Dr. Patnesia. Check with your primary care physician before visiting any doctor.